Now tell me, if you've got that chronic sinus infection, you haven't done surgery, tell me what the surgery is like and why it's less invasive. I like that word. That's exactly right. It means we can do it easier and the patient doesn't have as much trouble.
Surgeries are quick. They're quicker than they used to be because we have tools that more precisely and accurately remove those areas of obstruction.
What is the area of obstruction? You mentioned it before.
The osteomeatal area.
Now before, didn't they used to go in and punch a hole in the sinuses and make awful noises and squirt water in there and drain it out? Do they do any of that much anymore?
Not much anymore. And there are lots of old stories about those kind of procedures that scare people because they hear stories about people who had pain and had lots of packing in their nose to stop bleeding. And those
You don't put packing anymore?
I don't at all.
Why?
It's just not necessary. I think if you control the disease process with the tools we have and make sure that people aren't bleeding at the end of the surgery with cautery devices that we utilize, there's just not a need for it. And people wake up much happier. Most people have a little burning in their nose that may last a couple of hours, and with rare exception, most people don't have pain. They'll come back and tell me, you gave me a lot of pain pills and I took 2.
In the old days, they used to get black eyes and pack the nose and you pull. Do they get black eyes now much?
Almost never.
So the equipment that you have, how does it work differently? Does it have a better suction or just better visualization? What's it doing?
The tool that most of us use is called a shaver.
Shaver.
And it's really
like on my face?
A little different than that. It's adapted from the orthopedic surgeons. It's what they use in joints to take little cartilage fragments out. And it's a long, hollow cannula that has an open mouth at the very end and another hollow cannula on the inside that rotates. It has a blade attached to it so that you can suction and cut out the tissue, if you will, that's diseased or plugging the area of the sinus, that osteomeatal unit. Same device can be utilized to clean out the ethmoid sinuses, and I mentioned that's the other problem area in people.
Now, where are the ethmoids again?
Now, those are the ones that are between the eyes, and the ethmoid cavities are sort of a honeycomb space that will encase infection. The honeycombing is made of little thin bony walls, and those areas have to be opened up in order for adequate drainage and to get the infection that's stuck in there out.
Are they hard to open up, that honeycomb?
No, with appropriate tools, it's quite easy.
So frequently, if somebody's got sinus infection in the ethmoid sinuses and the maxillary, you open that osteomeatal unit and you you open up the ethmoid sinuses. And they don't come out with black eyes and packing and all that?
And they don't come out with black eyes and packing. And again, we'll utilize that CT that we talked about earlier to help guide our surgery. It gives us great anatomic landmarks to guide the surgery, and it tells us where is the problem. If the problem's not in the ethmoid, then that can be bypassed. If it's just in the cheek sinus or osteomeatal area, as we discussed, then you can focus your surgery just on those areas, fix just the problem that needs to be fixed, and leave the rest of the normal anatomy alone to function the way it was intended to work.